Hello, everyone. It's September the 16th, Friday. Regretfully, we've lost another 30 folks in West Virginia. I really ask for your prayers, and I remind everybody over and over, as I've done, that this is not over. This thing is just flat not over. And, we can live with it. I absolutely ask you over and over to think really hard about vaccines and getting vaccinated. It's really important. And with all that being said, please get your booster shots. Of the 30 additional deaths, the 7,335th death is a 92-year-old female from Raleigh County. The 7,336th death, a 54-year-old male from Raleigh County. The 7,337th death, a 97-year-old female from Wood County. The 7,338th death, an 83-year-old male from Mercer County. The 7,339th death, a 95-year-old female from Raleigh County. The 7,340th death, a 74-year-old male from Lincoln County. The 7,341st death, an 85-year-old female from Wayne County. The 7,342nd death, an 87-year-old male from Mercer County. The 7,343rd death, an 81-year-old male from Kanawha County. The 7,344th death, a 79-year-old male from Kanawha County. The 7,345th death, a 92-year-old female from Mingo County. Here's a really tough one. The 7,346th death, a 42-year-old female from Ritchie County. The 7,347th death, an 85-year-old female from Pocahontas County. The 7,348th death, a 79-year-old male from Monongahela County. The 7,349th death, a 64-year-old female from Harrison County. The 7,350th death, a 90-year-old male from Marion County. The 7,351st death, a 97-year-old male from Gilmer County. The 7,352nd death, an 89-year-old female from Marion County. The 7,353rd death, a 51-year-old male from Cabell County. The 7,354th death, an 80-year-old male from Wayne County. The 7,355th death, a 76-year-old male from Cabell County. The 7,356th death, a 65-year-old male from Nicholas County. The 7,357th death is a 96-year-old female from Monongahela County. The 7,358th death is a 91-year-old female from Boone County. The 7,359th death is a 92-year-old male. The 7,359th death is a 92-year-old male from Harrison County. The 7,360th death is a 54-year-old male from Mason County. The 7,361st death is a 76-year-old male from Clay County. The 7,362nd death is an 88-year-old male from Raleigh County. The 7,363rd death is an 83-year-old male from Marion County. And the 7,364th death in West Virginia is a 79-year-old male from Mineral County. Please, if you know them, call them, go see them. Absolutely, reach out. And if not, just please offer up your prayers. Some way, somehow, I know they'll hear your prayers. Active cases in West Virginia, 2,288. New positive cases, 689. The daily positivity rate, 10.67. Cumulative rate is at 8.55. We have above 585,000 people that have recovered from this in West Virginia, 278 that are hospitalized, 44 in the ICU units and 14 on ventilators. And the county map you see, or the statewide map you see, is full of yellow and green and 2 gold counties. So it's probably a little teeny bit better. I remind you over and over about your booster shots. I have taken my Omicron booster shot. Absolutely no side effects whatsoever, a little bit of sore arm, but so what? It's available to 12 and older at this time. We started with the over 65s, but please just check with your pharmacies or whomever your frontline health clinics or whatever, and see if you can get that booster shot. All the stuff about all information about our COVID, this terrible pandemic and everything is up on our website. From the standpoint of the numbers, slowly but surely a little bit better. From the standpoint of the vaccine calculator, go to our website and register. It'll help you be able to know when you're due for your shots. Long-term care facility outbreaks, 105, none in our church communities, 52 inmate and 46 staff cases today. Now, there was 3 pieces of major legislation that just happened in our special session. One was connected to our highways, from the standpoint that we put another $150 million into highways, 25 for new equipment, and 125 for resurfacing. We're on a quest, absolutely, to just fix every road in this state. We've done an amazing job, and our highways folks need a lot of credit. I ask you over and over, if you're driving and you see those barriers or orange cones, please just slow down a little bit. I mean, you got people that are standing out there on the road that are 3 feet from you, and it's really risky work and everything. So slow down a little bit, and if you happen to get stopped and everything, and you're sitting there, roll your window down and reach out and thank those people and everything, because they're doing great work. The first thing really and truly that we did was we certified industrial business expansion development zones, 2 of them. Berkshire Hathaway is coming to the state of West Virginia. It's amazing beyond belief. The investment is going to total in the hundreds and hundreds and hundreds of millions of dollars, and I truly believe it's going to bring thousands of new jobs to great West Virginians and opportunity off the chart. Really, really great stuff. The final piece of legislation was the passage of the bill that I call that protects life. Many people refer to it as an abortion bill. Now, it has come to my desk, and I want to tell you right now I've done exactly what I said I would do. I've signed it. It's done. It is absolutely done. And with that, it will go up today, and later today, it'll go up to the different channels that it flows. With that being said, let me just tell you just 2 or 3 things. First of all, I truly believe that the U.S. Supreme Court came out and changed this law. And basically then it passed down to the states. And then it demanded action from the legislatures in the state. I said over and over and over, I stand strongly for life. There's no question that everybody knows me and knows that. But I also said we have to have reasonable and logical exceptions. With all that being said, I then said, if the legislature sends me a bill, if they craft a bill that has reasonable and logical exceptions and everything, it is their beliefs and their responsibility to bring me that bill. And I said I'd sign it. And I don't say many things in this world. In fact, I hope and pray I don't say any. When I tell you something, I do it. Now, I'll make mistakes, but I do it. And I really, truly believe that there's reasonable and logical exceptions that they brought us. Now, with all that, this is such a volatile bill, that there's people that are going, on either side that are probably not going to get everything and anything that they wanted. From my side, from where I stand, the legislature brought me this. They had overwhelming support in the legislature, and I think what I should do is exactly what I did, and that's why I signed it, and I'm proud that I signed it, and I believe wholeheartedly that it does one thing that is absolutely so important. It does protect life, and that's good stuff. So with all that being said, I think we move on and keep on trying to do any and everything we can to perpetuate all of us in the state of West Virginia in as a positive way we possibly can. I remind you about the Homeowners Assistance Program. that absolutely was still room there to sign up, and there's real dollars there available to you. I remind you about giving blood. It is really important. Red Cross needs you very badly. Here's some, Small Business Administration disaster possibilities, but I'm going to read this to you. But the West Virginia businesses and residents affected by the severe storms and flooding on May 6th are eligible to apply for low-interest disaster loans from the Small Business Administration. This declaration included Cabell and the adjacent counties of Lincoln, Mason, Putnam, and Wayne counties. And the Small Business Administration made these loans available in response to a letter from my office requesting a disaster declaration by the SBA. So all this is good stuff and everything, and hopefully this will help a bunch of folks there. Take advantage. Please do that. The other thing is we've got three national blue ribbon schools. And this is, and I hope I pronounce this right, Culloden Elementary in Cabell County, Evans Elementary in Jackson County, and C.W. Shipley Elementary in Jefferson County. And I congratulate those great teachers there, the great service personnel that are all doing incredible work, the administrators, and most of all those students. So many, many, many congratulations. They're among 297 schools across this country that are blue ribbon schools, and so lots and lots and lots to be really proud of there. I've told you about the Berkshire Hathaway announcement and everything that just happened. It's going to happen at Ravenswood. It's going to happen on a little better than 2,000 acres. Going to start out with a couple hundred jobs, and as it builds out, it is going to be an absolutely unbelievable amount of flooding of jobs that are going to come to that area and to our great state. It is going to be in the manufacture of titanium and everything that is basically a product that they're using for the aerospace and other industries. It is, I'm telling you, when Berkshire Hathaway comes to West Virginia, if it's not big news, I don't know what can be big news. So with all that being said, I salute all those that pulled the rope and made this happen and everything, and especially those folks in economic development. Glenn Jeffries wrote a letter, and lo and behold, then all kinds of great things started to happen. But behind that letter had to be a lot of great work by a lot of people pulling the rope. I was really, really proud to be a part of that. And lo and behold, look what's happening in West Virginia right now. Right now in West Virginia, Berkshire Hathaway joins the Nucors and the Green Powers and Pure Watercraft and on and on and on, coming to this great state and bringing us opportunity. The bottom line to the whole thing, as we've said it a thousand times, is so many. We know how great West Virginia is in every way, but so many of our families had to leave and everything to be able to find opportunity and to find a job, to find a good job. Well, now we're hoping and praying a whole bunch of them will be coming home. The tourism conference on Monday, I attended that in Huntington and everything. Secretary Ruby, what an incredible job she's done. And I just saw, they just flashed it up there and everything. And I can see Secretary Ruby and Baby Dog sitting with me there. But just imagine these numbers just for a second. Since 2019, the national average of tourism growth throughout all the country and everything was down 27%. In West Virginia, it wasn't down 27%. We were up 3.8%. Can you imagine that in 2022, we're going to exceed $5 billion of people coming into our state and spending through tourism? I salute all those that are involved in this incredible industry. You've done great, great, great work, and just keep doing it. Keep thinking outside the box and everything to absolutely bring more and more and more travelers and more opportunity to West Virginia. It is absolutely on the move. We had to tell our story, didn't we? We had to invest in tourism and tell our story, and then all of a sudden, look what's happened. Really and truly, every dollar we invest in tourism, we bring back almost instantly 10 times, 14 times, whatever it may be. Absolutely, this industry is really on the move. And I told the folks there, and I mean it, I really believe that we are just absolutely touching the edges around the plate. We are picking up the parsley around the plate right now. The meat and potatoes are still available right in front of us. And there's going to be more and more and more positive growth in tourism. In fact, this industry needs to explode in West Virginia, and absolutely we're doing it, but it needs to just keep getting better and better and better. You know, from a standpoint, jumping back, you know, well, I think that's it. Wait a minute, hold on, I'm done. That's the last thing I had, so I'm good, I'm done.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor has reminded us that particularly related to the COVID-19 pandemic, we are still not finished with our challenges with this virus. In the United States, over the last week, we've seen close to 400 deaths a day. And if you look at that across the year of 2022, we have experienced 221,000 deaths this year so far. So this is, to me, unacceptable. From the perspective that COVID-19 today is a preventable, treatable illness, preventable by being fully up to date with vaccinations, including the new COVID booster for those that are eligible. Also to get tested. And let me correct something that I said last press brief so that I'm communicating better. On the COVID-19 dashboard at DHHR, there is a tab that says find free testing close to me. And then there's another separate tab that says find free testing. That is where you should go if you decide that you want a PCR test. If, as we said, if you have symptoms, you do the rapid tests and they're negative, or if you want to get a PCR test to be more, to feel more secure that you don't have COVID-19, because a negative PCR test is certainly the best test that we have available to detect COVID-19. So please go to find a free test close to me, because some of the entities like the county health departments that I mentioned last time, some don't have access to those tests at this point and others do. So please go to that to find the right place for you close to your home to get a PCR test if you choose to do so. But we also know that people that do test positive for COVID-19 who are vulnerable, as the governor said, who are older, we know that over 50 years old, we see about 95% of our deaths and about 75% of our deaths in West Virginians over 65 years old. So please test yourself. And if you test yourself and you're positive, then contact your healthcare provider so that they can consider giving you treatment, which may further protect you from having severe disease, hospitalization, or death with Paxlovid or others. So this, to me, is an opportunity moment for us in West Virginia to continue to see our deaths go down. We are seeing a reduction in the number of cases, which does suggest that we've passed the peak of this BA.5 Omicron variant surge, but we still are seeing too many people in West Virginia and in the United States die every day from a preventable, treatable disease. And we hope that you will pay attention to the governor's pleas for all West Virginians to be up to date with your vaccines and to be careful to test yourself with symptoms and to get the right treatment so that you protect yourself and each other. Thank you.
Thank you, Dr. Marsh. Secretary Bill Crouch and Dr. Ayn Amjad are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering what insight or any information you could tell us about this 1 o'clock economic development announcement. There's been some reporting out there, but, the communications for this announcement were being handled by a private firm. We were told it wasn't being live streamed. It just seemed like this announcement was being handled differently than the Nucors, the Pure Watercrafts, the ones you just mentioned. I was just wondering what you guys could tell us about that. Thank you.
Well, Charles, I can't one up them. I mean, really and truly, Charles, it's hard to keep up with them, isn't it? Really, I mean, in all honesty, we just keep turning them out, and that's exactly what we need to do. You know, Mark Curtis, brought up that same very thought and everything, but it is being handled by the company, and we won't one-up them and everything, and we'll wait and see, and you'll just have to hold on and wait just a little while, because it's not very long. We'll all know, or you guys will know.
All right, thanks, Charles. Next to Jess Mancini with Ogden Newspapers.
Hi, thank you very much. Can somebody explain the rollout of the new Omicron boosters? I went to the website vaccines.gov. Hope I got that right. Vaccines.gov to check on local sources, and most here in this area, they were mostly in Ohio. So I guess my question is, could that be that the website isn't up to date? And thank you.
Dr. Marsh, can you help us with this, please, or is this for Secretary Crouch or Dr. Amjad?
Well, maybe I'll start, Governor, if that's okay, and then certainly invite Dr. Amjad and Secretary Crouch to add anything in. Jess, thank you for your question. We are very, very committed to making sure that all West Virginians have access, who are eligible by the FDA and the CDC criteria, to the new Omicron booster. And there's really several ways to identify close to you where that booster may exist. So number one is that we would recommend you go to the vaccine calculator. And as part of that, then you should be able to identify those places close to you after you are found to be eligible for the new Omicron booster. That should then help you not only identify those places, but also be able to schedule directly with those places. The second one, as you said, there is a vaccines.gov website that can identify places close, which I believe is a national website. Or the last way to go is to call the COVID hotline number and then use help that way to be able to identify a location close to you. We should have places throughout West Virginia. Pharmacies have also received these new Omicron booster shots. And so there should be areas close to you. Now, one caveat here is that we will see, at least immediately, more Pfizer Omicron booster shots than Moderna. Moderna did have some production issues, some supply chain issues. So the federal government is providing more Pfizer Omicron booster shots than Moderna immediately. That should even up over a short period of time. But we know that it's safe to mix and match if people have gotten Moderna shots up until now and are looking to get a booster shot. It's okay to use the Pfizer Omicron booster, even if you've previously had the Moderna one. And the other thing to know, and particularly as we get into October, that getting your Omicron booster shot along with a flu shot is not only something that is available, but something that we would heavily recommend. And right now is a little bit on the early side for the flu shot, but if you don't have another opportunity then today, then certainly getting a flu shot with your Omicron booster shot today is okay. But as we go through October to the beginning of November, that's really the optimal time to get a flu shot as well, because we anticipate we might have a significant issue with the flu this year. So Ian and Bill, I'll throw it over to you guys.
Sorry, Clay, the only thing I'll add, Jess, is on the vaccine.gov, when you enter your zip code, you do have to pick which booster you want. We refer to it as the Omicron booster because to us it makes a little bit more clarity. But then, on the vaccine.gov site, you have to click the authorized bivalent booster. And most of the pharmacies in the state do carry it that we've seen, at least even in Southern West Virginia. And then if not, you can call a health department and see, but there should be some in your area. I'm not sure exactly where you are, but that's all I can add, Clay.
Yeah, and this Bill, let me add, Jeff's good question. There's also been some confusion about the JIAD of getting doses of vaccine. That is for individuals in the long-term care system, our nursing homes and assisted living facilities, and our hospitals for healthcare workers. So for those folks who can't get out and get to the pharmacy, the JIAD continues to try to make sure that those boosters, the Omicron booster, is available for those folks. So we're working with the Healthcare Association of the Long-Term Care industry out there to make sure folks have access to vaccine as well.
All right, thank you, Jess. Next, we'll hear from Rachel Pellegrino with WOWK.
What's that?
Good afternoon, Governor. So I've been told that the abortion bill will become effective immediately, but I did want to clarify, will those penalties also become effective immediately, including those criminal penalties that the bill states would be in effect for those that are not licensed and conduct abortions? I also did want to ask you, what effect do you think this bill will have on West Virginia?
Rachel, you know, you got a lot of noise there in the background and everything, but you know, I think the criminal penalties, the whole bill goes into effect. I think it's 90 days. Is that correct? Or the bill is effective immediately. The criminal penalties are effective. Okay, the bill is effective immediately. The criminal penalties are effective 90 days from today. You know, so nevertheless, but Rachel, from the standpoint of where I stand, here's exactly where I stand, and I've said it a whole bunch of times. I expected the legislature to do their job. I expected them to just do their job. And it took a little while, but really and truly, they did do their job. And so I thank them for bringing me a bill. I asked them that they absolutely bring me a bill with reasonable and logical exceptions. They brought me that and everything. I told everybody that I would sign the bill, you know, unless it was just some way out absolute thing, you know, that there's no possibility that anybody would sign. I expected them to do their job. Overwhelmingly, it passed and everything. They did their job. There's exceptions and there's reason and there's logic behind it, and I absolutely signed it, and I'm proud of it.
All right, thanks, Rachel. Governor, I'll turn it back to you.
Well, while this is going on here, you know, I normally don't do this, but you know, I've got just noticed, you know, because I usually don't have my phone, but my phone's pinged a couple of times and everything. But you know, there's 2 or 3 people here that we've lost and everything. Dr. Pat Brown, you know, at the Greenbrier Clinic, was there at the Greenbrier Clinic for a long time. And Bobby, you know, Bobby Brown's wife, I think it's Diana and everything. But you know, but nevertheless, you know. Great West Virginians, but there's one other that's just a kid that I saw grow up and everything. But our CFO, Terry Miller, a great person that I've worked with, him and Donna, great family. You know, Jeff heads up our parkways today, and Brian, you know, their other son, young man and everything, just very tragically. We just lost him, and still the details are, you know, uncertain and everything, but it doesn't really matter. You know, it's just tragic beyond belief, and so all across this great state, we've now lost 7,364 folks. I ask for your prayers for all of them. I ask for your prayers for these families that I just, you know, named and everything, because we've lost some really good folks and really great West Virginians, and we need to be prayerful, in my opinion, for all that and all those great folks and everything. And some way, somehow, the families and all the loved ones will get through it. But boy, it's some tough stuff. And so a lot of this stuff, you know, hits home, and you know, it hits every last one of us. There's nobody immune to all that's been going on here. We've lost, like I said, 7,364 folks. These 3 folks, you know, not that, but it's really sad. So please keep all these people in your prayers, and the same for all our legislatures, myself, and everyone, you know, in trying to do the people's work and trying to do the very best we possibly can, and do the right work and push the right buttons. So So a lot of good stuff happening in West Virginia. Let's stay positive. Let's keep moving forward and everything. And thank you so much. God bless each and every one of you in every way.